Infection Control Team in Hospital. Infection Control Committee or ICC can be defined as an integral component of the patient safety program of the healthcare facility. The committees are responsible for establishing and maintaining the infection prevention and control, its monitoring, surveillance, reporting, research, and also education. Infection Control Team or ICT should comprise of at least an infection control officer, a microbiologist if the infection control officer is not a microbiologist, and also an infection control nurse. ICT usually takes daily measures for the infection and control of infection in hospital. There are several important duties and responsibilities of the infection control team members, which includes the responsibilities in administrative controls. Administrative controls are fourth in the hierarchy of hazard controls. The members of ICT will need to monitor the compliance with infection control policies, including the activities directly related to the audits, and participate in the development and implementation of the infection control policies. The members should also prepare reports within a specified period of time. Next is responsibilities in education. ICT members need to advise staff with regards to the microbiologic hazards in occupational health safety and related issues in infection control. Aside from that, the members need to participate in teaching programs for all healthcare workers. They also need to keep up to date with recent advances by reading relevant literature and attending appropriate courses, meetings, and exhibitions. ICT members also should participate and coordinate the infection control related educational campaigns. And lastly is the responsibilities on the research and quality improvement activities. The members need to participate in research projects that are related to hospital infection and perform clinical audit or quality improvement projects on the infection control activities to evaluate its effectiveness.
ASYIKIN MOHAMAD OTHMAN, I will present about guideline and policy related to infection control.
Shear injury policy. These are the flow process of shear injury. When shear injury occurs, the involved healthcare worker need to report to the location supervisor. Then the location supervisor need to refer the injured healthcare worker to a doctor. The location supervisor then need to fill in two notification forms, which are accident reporting form and WHU N1 and WHU N2. Then the accident reporting form need to be submitted to quality unit, while WHU N1 and N2 need to be submitted to the occupational safety and health committee secretary. Then the occupational safety and health committee secretary need to inform the infection control team by using a copy of the WHU N1 form. Lastly, the infection control team need to submit the complete registry to the state occupational health unit. Next, infection disease outbreak policy. There are several steps of infection disease outbreak. First, infection controllers need to conduct a probable diagnosis regarding the outbreak. Second, they need to examine and gather information regarding the outbreak. Third, they need to inform all the parties involved and carry out further investigation regarding the outbreak, such as patient screening and contact tracing. Next, produce a report regarding the outbreak, then administer outbreak control measure according to the mode of transmission and annals and of outbreak, and lastly, disseminate report to all relevant departments. Staff hepatitis B screening and vaccination policy for healthcare workers. The blood test for hepatitis B screening test consists 3 tests, which are hepatitis B surface antigen, hepatitis B core antibody, and hepatitis B surface antibody test. Hepatitis B vaccination must be taken to reduce within 6 months and administered via intramuscular injection. There are 1 month gap between first and second dose and 5 month gap between between second and third dose, the healthcare worker must get anti-HB serology test 1 or 2 months after the final dose of vaccination.
I'm ATIQAH. I will present on the prevention of healthcare-associated infection. So, healthcare-associated infection, HCAI, is an infection that occurs more than 48 hours after admission. Usually, patients or healthcare workers acquire HCAI from healthcare settings like ICUs, wards, operation theatre, and hospital laboratories. Therefore, it is important to follow the policies and procedures on infection control guidelines provided by Ministry of Health. For my part, I will explain the prevention for the 4 common settings mentioned earlier for HCAI.
Firstly, intensive care units ICU. It can be further divided into prevention for healthcare workers and visitors. First, for healthcare workers. Healthcare workers should perform hand hygiene before and after entering the unit. Healthcare workers with transmittable infection are prohibited from working. Next, healthcare workers need to wear proper attire at ICU like PPE according to the type of procedures performed. Wear mask and glove when performing procedure. Lastly, healthcare workers should change gloves after every procedure. Make sure to also perform hand hygiene before wearing and after removing the glove. As for visitors are limited to 2 people per patient at a time. They should also perform hand hygiene before and after entering the unit. Lastly, visitors should observe closely for transmission-based precautions. Next, ward. For ward environment, it should be neat and tidy at all times. The cleaning tasks need to be done in the order of clean to dirty. Make sure to clean floors using dust-retaining mops and not brooms. Also, clean and disinfect frequently touched surfaces or areas at least once daily. As for the medical instruments and equipment, the reusable medical items need to be decontaminated before disinfection or sterilization. The integrity of packs of all wrapped or packaged sterile items must be maintained to prevent contamination. If it is suspected not sterile, for example, in the case of damaged packaging, do not use it. Lastly, observe the precaution measures for each different type of medical equipment accordingly. Other important clinical setting is the operation theatre. At operation theatre, healthcare workers should follow the principles of operating theatre and its procedures, such as the location of the operating theatre suites, the layout of the operating theatre, the doors, the suitable temperature and humidity, and the air supply. Healthcare workers should also be reminded to wear PPE during procedures. Next, they need to strictly observe their hygiene practice and sterility of each equipment to make sure both the healthcare workers and the patient are protected against infectious agents present in the operating theatre. Lastly, workers should follow the cleaning policy of operating theatre, which includes initial cleaning, concurrent cleaning, and the terminal cleaning at the end of the day. Lastly, hospital laboratory, which is one of the most dangerous settings. According to Ministry of Health, all diagnostic and healthcare laboratories, which include public health, clinical and hospital-based laboratories, must be designed for biosafety level 2 or above. Therefore, the workers need to practice the standard precautions and promote good microbiological techniques to minimize the risk of such hazards. Workers should also follow the code of practice provided by the Ministry of Health, in which the elements include access to the laboratories, personal protection that the laboratories workers need to practice, procedures, working areas and biosafety management. The guidelines also include transportation of infectious substances, waste disposal, health and medical surveillance, and safety training for lab workers.
My name is HASNIZA binti Muhammad ARIFIN, matric number 1813450. So next, I will proceed the presentation with the topic of sterilization. Sterilization is a process that destroys and kills all forms of microorganisms which is carried out by a physical or chemical hazards. It provides the highest level of assurance to eliminate viable pathogen and non-pathogenic microorganisms, including spores. Classifications of items that need to be sterilized. There are 3 types of items, which are the critical items, semi-critical items, and non-critical items. The critical items are medical devices that have contact with sterile tissues or fluids. These items should be sterile when be used because any microbial contamination could result in disease transmission. The example for critical items including surgical instrument and biopsy concept. The second one is semi-critical items, which are the items that come in contact with mucous membrane and not intact skin. The example is laryngoscope. And the last one is the non-critical items, which are the items that come in contact with intact skin but does not in contact with mucous membrane. The example for this type of items including the linens and bedside tables. The last one is the sterilization method. The sterilization method can be classified into two types, which is physical method and chemical method. The physical method can be classified into heat, filtration and radiation. The heat method is the most widely and reliable method because it can disrupt the enzymes and the cells of a pathogen. Sterilization also can be done by the use of chemicals. Although heating method is the most reliable method, but it is not always appropriate because heat-sensitive materials such as biological material, fiber optics and many plastic can be damaged by it. And the chemical method can be classified into two types, which is liquid method and gaseous method.
Okay, next, I am NURUL binti SHAFERUDDIN, and we further discuss on antibiotic surveillance, which is one of the practice under infection control team. So the hospital infection prevention and control team plays a very important role in reducing the spread of antibiotic resistance by doing antibiotic surveillance. Okay, so the emergence of the antimicrobial resistance has also led to introduction of antimicrobial stewardship, or also known as EMS programs, to improve the infection prevention and control in healthcare settings. So this program is under the purview of the Hospital Infection Control and Antibiotic Committee, and also the head of the AMS team is either an infectious disease physician or pediatrician, senior physician or clinician that is deemed to be suitable by the hospital director. And also the other members of this AMS team could also include from antimicrobial pharmacists or clinical pharmacists, clinical microbiologists or microbiologists, information technology officer, or also infection controllers. Alright, so antibiotic utilization surveillance at the national level has been established in selected Malaysian hospitals since 2001. So currently, it is known as National Surveillance on Antibiotic Utilization, or also known as NSAU. So this NSAU aims to first to collect national data on antibiotic utilization in hospitals and primary care facilities. Secondly is to monitor trends of antibiotic utilization. Thirdly is to report antibiotic utilization data at local, national, regional and also international levels. Fourthly is to use antibiotic utilization data to guide interventions at facility level. 5 is to compare the use of antibiotics among healthcare facilities, and also lastly is to establish national benchmark for antibiotic usage. Okay, so we have come to the last part of this presentation, which is a summary and Islamization. So for the summary, we would like to enhance the importance of the infection prevention and control practices in maintaining a safe environment for everyone by reducing the risk of the potential spread of the disease. These practices that are mentioned in this presentation are designed to reduce the risk of hospital-associated infections and also to ensure a safe and healthy hospital environment for our patients, healthcare providers and also the visitors. Okay, so lastly, for Islamization part, we would like to conclude that Islam is a holistic belief system and it takes into account the physical, emotional and spiritual well-being of individuals and so also societies. So although care of the individual is very important, safeguarding communities, including its weakest members, is of paramount importance. So according to the second level of Maqasid Sharia, Muslims are obligated to protect the life and also the life of others too. So in this case, infection control team is responsible to control and prevent infection in community settings, which is aligned with this Islamic teaching to protect their life and also the life of others.